Bulawayo, the challenges of the quarantined people are similar to what is happening in all the provinces. People running away from quarantine stations. But what I was happy about in Bulawayo was the fact that the community was able to identify some of the people who had run away and told them to say, you cannot come home because we think that you need to have a certificate of having been tested and that you are negative. And that these people who were denied by their families had to go and surrender themselves back to quarantine stations. And we encourage the community here in Bulawayo and throughout the country to make sure that you don't take in people who have come from outside our borders, whether South Africa or Botswana or anywhere else, without assuring yourself that they have been tested and they have been found negative, because they're a danger to the family, they're still a danger to themselves. And I'm very happy that Bulawayo, because of the campaigns that the committee is already doing, Bulawayo people are actually doing that service, sending people back to the quarantine station. As you are all aware, most of the spikes that moved from 52 to 130, 56 to 132, most of the people were coming from quarantine. 75 of them were coming from quarantine people who were quarantined. So we encourage Zimbabweans to make sure that they don't take those people without being quarantined. The committee here is seized with a number of challenges, but these challenges, they have solutions which they are giving. For instance, we have to finish our preparedness for the areas where we can have people in hospitals, in high dependence units or in intensive care units. And the selected areas are Thorngrove, which you all know, Escoven, and UBH. Right now, work is still excellent, and work is still going on in all those areas. We cannot say we are 100% sure, but UBH, I've been informed, could take 1 or 2 or 3 where if they need intensive care units. Thorngrove right now already has 1 person who was found to be positive, and they could have been quarantined at home, but the family in which they live is such that you cannot isolate them. So the only place where they can isolate is in Thorngrove, which is a hospital, although the person is quite fit. I was also very happy about what I was informed of the people who were positive. The number of those who have recovered is quite pleasing here in Bulawayo, and they recovered while isolated at their places of residence. And this augurs very well, although we have had additionalities. In terms of, so the preparedness is going on. The government is providing funding for Thorngrove, is providing funding for Escoven, is also providing funding for water, especially Rochester in Nyamandovo. I was informed that water, where last time I was here, they were getting 3 megaliters from Rochester. At present now, they are getting 9 megaliters. And we are continuing to assist the city as well as Zimwa so that they can get more water from Rochester. And in the next week, I think they will be getting more finances so that they can bring water from Eppington, which is also in the Nyamandovo area. Those are the areas of challenges. But the security people were briefing me that there are too many people now in town and transportation system. So we are still going to meet in the morning together with Zupco people, with the city, to see our planning for vending, and also our planners from the Department of Physical Planning, so that we can relook at both transportation in relationship to vending. And that is key. The security people will be in there so that they can also point to us the areas of difficulty in controlling the people, either at bus terminal or at vending places, or at normal stores. We need to discuss that and come up with a strategy. The solution is to come from here, and some solutions can be implemented without recommendations going upwards, and that's what we want to do. But I'm very happy with the progress and the cohesion of the team that I see here under the leadership of the Minister of State for Provincial Affairs and Devolution. She's quite strong, and I think the vision that I see from the officers she's working with, the health strategy which is coming from here will guide how we move. So the officer that I brought from the command center, Dr. Fusire, I was informed about the nurse at Mpilo and these two who had come from the western suburbs. Of course, once we get that, there is tracing that has to take place to go and isolate and say who the people who were infected. But as you know, all the statistics that come from your testing teams who then take it to the laboratories, such as the one at Mpilo, all those statistics are fed into the national statistics of the Ministry of Health. And it is only the Ministry of Health which announces. So I can't believe that anybody would have announced without the Ministry of Health knowing, because we need confirmation systems. But of course, the worrisome is that the nurse who must have attended to these two also got infected. So now we need to isolate that nurse so that she does not contaminate or have the virus to her family. That is the area where we are having bigger challenges. And we are looking for alternative isolation centers. For those who are positive, we know where to take them. But for those who are nurses and or doctors or anybody who is in hospital who is working and gets in contact with, who might get in contact with patients or anybody who is coronavirus positive, we now need to isolate them also so that they don't go and spread this virus to their communities or to their homes. In order for businesses to test, to open, they need to test. But more importantly, the emphasis really, for now, because of the challenges of cartridges, of testing equipment, the emphasis for businesses is to make sure they have these thermometers, they have sanitizers, they have a place where people can wash their hands, they have these masks. Those are the 4 areas that we are stressing right now. And while we are not saying companies should not test, we know the difficulties that is there. And even now in the country, we are facing challenges of testing kits or other consumables that make us have testing go out smoothly. So the companies are faced with the same thing. So let's emphasize to companies that make sure that you take temperatures, and if somebody's temperature is too high, beyond a certain recommended level by Ministry of Health, WHO, send that person so that they can be tested, or send them home for isolation. You make sure that they wash, they have a mask. And the mask, by the way, is a legal requirement now for all of us, and not just those who are going at work. And so those are the 4 things that we must emphasize for now. A lot of some of these things is a distributive network. And that's why we now have a command center. I was just explaining to the team that in this command center, when it comes to materials, they are distributed in two ways. All medical are distributed through NatFarm. What the committee here should be doing, I was advising them, is have a committee that sits, mostly of the medical people led by the PMD for Bulawayo, sit with NatFarm and say, what have we received of all the PPEs and where should we be distributing them? There is the police, there is the defense, there is other frontline workers. Whatever we will have got, are we distributing it? These frontline workers can get them. That's one aspect of materials. The second aspect of materials is non-medical, which is also distributed by the command center, and this includes the food that has to be eaten in quarantine centers. The people of Zimbabwe have responded to the president's call for supporting, and every week you see how we are receiving food items, and those food items will lessen the burden of government when it is feeding people in quarantine centers. And it can also help these items, it can help the frontline workers. And we think that the structures that we are strengthening at the command center to make distribution much more equitable. For instance, the security sector is going to be making sure that logistics for distribution of those things is done, and is done better. And you know, the security sector is more equipped for this for logistics than most other civilian organizations. So that's what we are correcting. Is because we think some of the times, like sanitizers, we were being told by NAST how many sanitizers they produced. 46,000. Yeah, these masks, and they are all bought by NatFarm. So I don't think NatFarm will buy those and take them to Harare if the organization here is very well organized and they talk to Harare and they say sanitizers, these masks have been produced at NAST. We want them to be here in the region, not just in Bulawayo. The region can mean from Bite Bridge to through Mberengwa, my home, to Mazingo, or to Victoria Falls. So that region can be covered. There are other sanitizers and masks which are being produced in large quantities by universities all over. There is not few universities, not few, but many of them. NAST is doing it. Midland State University, Great Zimbabwe University. There is even the non-state university like Dr. Ezekiel Guti. They even came with a sanitizer where you can walk through. They have invented that. So sanitizers are being produced all over, as well as masks. And we expect that we should cover as many frontline workers as we can. The Law and Order Committee at national level, which is chaired by the Minister of Home Affairs, has recommended certain solutions because we have long borders with our neighbors, and we know that people now are crossing. Some of the people who were caught here in Bulawayo had crossed through illegal borders, and they went to their family, and the family said, go back, and they be quarantined. So yeah, we are aware that there are a lot of crossings, and the Law and Order Committee of our interministerial committee has made some recommendations which will be taken. I cannot pronounce them, but I know that they have made recommendations in order to deal with border areas. Yes, I went to Plumtree this morning with the Minister of Environment and Tourism and the hospitality industry, just to look at what had happened. When it happened, when the president was briefed by Vice President Mahade, we all thought that since it is having quarantine people, that either the quarantine people will be left shelterless, and secondly, that materials that belong to what we wanted to use for those quarantine people would have been destroyed. Fortunately, when I got there, is the only thing that was destroyed is the bite hall. The hall that was built in 1929. It is the one which was gutted. I am sending a team led by the provincial director for public works from here. You will go as an engineer together with a structural engineer, a civil engineer, and a quantity surveyor, as well as an electrical engineer. From a layman's point of view, I saw what could have happened, and everybody who was there believes maybe is the cause of the fire. There's a very old electrical system where we believe the fire started. Fortunately, although it is so linked to the classrooms, the fire did not jump to classrooms, and they fought until the fire just destroyed the bite hole itself. And when it went to the other side, on the right side, where it is also linked to another classroom block, you see, it's a quad. And so the hole is at the center, and on both sides and on the other side are classrooms, but it never jumped to those classrooms. So we are lucky. We are lucky. Nobody really was injured, and property in terms of books, in terms of furniture, except that which was in the hall, nothing else was destroyed. And when I asked the principal, Kumalo, he said mostly pictures. And he obviously wants to reconstruct that from alumni who can send him some of the pictures which are historical.
So there you are.